York's classic rock, Q1043.
I say good morning to Margie Balfour. She is the Behavioral Healthcare Practitioner of the Year. She's a psychiatrist and Chief Clinical Quality Officer at Connections Health Solutions. And she's here today because there is a growing concern about the number of suicides, particularly with COVID-19. It just has intensified. So Margie, tell us about that, because I know that the suicide rates have increased, most concerningly to me, among young people, 10 to 24-year-olds.
Mm-hmm. Yes. And, during the first 9 months of the pandemic, the rates of depression and anxiety were 6 times that of the previous year. And I think a lot of it has to do with the isolation, also the social determinants of health. So things like instability and people knowing if they've got stable housing or a job or able to pay the rent, or, the number of people accessing like food banks has skyrocketed. So I think there's a lot of many different things contributing to this. Also, what's really concerning is some of the disparities. They did a study in one of the East Coast states where they looked at the suicide rates. They didn't seem to change that much until you dug into the race and ethnicity, and they had actually decreased among whites and doubled among Black Americans.
But of course, COVID hit Black Americans stronger than among the white population.
Exactly. And also, the speculation was that also a lot of those socioeconomic issues around, the housing and the, income loss and all of that hit that population harder also.
When it comes to young people, for parents, what are the warning signs they should be looking for? Because kids tend to talk to their peers, and there's a lot, and we'll cover what we just found out last week about Instagram and that whole connection with body image and how that hurts teenage girls, and that increased the suicide rate. But what should parents look for?
Changes in behavior, changes in how outgoing they're being, who they're hanging out with, changes in sleep. A lot of times people with depression, I know it's sometimes kind of hard to tell in a teenager, but they want to sleep all day, isolate more, and just, changes from what's usual for them.
Let's talk a little bit. Oh, and then what should they do?
So, first thing, of course, is to try to talk with them, or, if make sure that they have the information they need to reach out for suicide counseling. So there is a nationwide national suicide prevention hotline. That's 1-800-273-TALK, DALK. Starting in next July, there will be a 3-digit number, 988. It's kind of like 911, that will connect to that suicide lifeline. And so most of the states are working on implementing that now. It's set to go live like mid-July of next year. And that will connect automatically to that suicide line, which then many states are looking at making that suicide line more integrated with what's going on in terms of connecting to crisis care in that local community a lot better. So right now, most of the cell phone services, you can dial 988 today and get connected to the lifeline.
That's tremendous, but most people don't know about. I didn't know about it. It is a tremendous idea, but how do you get the word out?
Well, I'm glad that you're having me on your show this morning. And that's what, the mental health community needs to get the word out. And it's a really exciting thing. It's actually it's a huge opportunity for a whole transformation in the mental health system. Think about how before there was 911 and what that did for the trauma system. And
Sure.
now we have all of these really well coordinated systems in our local communities that make sure that people get to the right hospitals with the right injuries and things like that. We have the opportunity to do that with 988. You're currently, most people, if they have a mental health crisis, they don't know what to do other than call 911. And that then, if you have a heart attack and you call 911, you get an ambulance. But if you are suicidal and you call 911, you get the police. And then that sets things up for, a police encounter where someone in crisis, which is, the police do the best they can. And a lot of them are doing crisis training so they can better recognize signs and symptoms of mental illness, but you're still setting up a person in mental health crisis with an armed law enforcement response. And then even if officers are trained to be able to de-escalate them and take them to treatment, oftentimes the only option is the emergency room, where so over 60% of emergency rooms have no psychiatric care capability whatsoever. And so they end up just waiting and waiting, and they call this problem boarding in emergency rooms, where they wait for hours, sometimes days, to be transferred outside to another hospital to finally get some kind of psychiatric care. And so what the opportunity there is with 988 is to really use that as a jumping off point to transform and to create a crisis system. And out here in Arizona, where I work out here with Connections Health Solutions, we have over the last 20, 30 years really invested in a robust crisis system that's being looked at as a national model as states are starting to figure this out. And ideally, the way the system works, and down here in Tucson, we've got crisis hotline people, and they have their crisis hotline where they get about 10,000 calls a month. They have some staff co-located with 911 so they can intercept those behavioral health calls. And they were able to resolve about 80% of those on the phone through suicide counseling, through, they have the ability in our system to make appointments at all the different clinics so they can help connect people to services. And then if they can't resolve the crisis, they dispatch crisis mobile teams that are clinicians, 2 clinicians usually, that can go out to where the person is. They respond on average in a little over half an hour. And then if they are able to do a face-to-face encounter, they resolve that crisis about 70% of the time. And then for people that are more highly acute, more agitated, intoxicated, dangerous self or others who need a higher level of care, there are crisis facilities like ours, where people can be either taken by police, or they can come on their own, or the mobile team can bring them. And at the Crisis Response Center down in Tucson, we get about 500 or 600 law enforcement drop-offs every month. Up in Phoenix, it's more than that. It's closer to 800. And we get officers in and out quicker than jail. So they actually prefer to bring people to us because they're back on the street in 10 minutes. And then there we can have them seen by a psychiatrist, peer supports, social services. Most people after an overnight observation are able to be discharged back into the community the next day. And that's the kind of system that we need for people who are experiencing suicidal crisis, but also substance use related crisis. I mean, most of the time people have more than one thing going on. They're suicidal for a reason. And, we need a system of care that is just as organized and reliable as that for your heart attacks and strokes.
I'm speaking with Margie Balfour. She is the Behavioral Healthcare Practitioner of the Year, a psychiatrist and Chief Clinical Quality Officer at Connections Health Solutions. We're talking about a 988 number, suicide prevention line that most people don't know about. Is the word getting out to schools? It would seem to me that if schools were involved, both with telling students about this and the parents, that would make a huge difference.
Yes, and one of the really cool things about 988 is as they're working through the details of the implementation, the FCC is going to require that it also do text. And so when you're talking about young people in schools, I mean, I don't even answer my phone. So, we to ask, kids to pick up the phone and call someone when they don't even do that with their friends. Having the text capability, I think, is going to really open that up and make it much more accessible to that population. As far as getting the word out, it's really at this point, the states and the local communities that are working on it. I think since the implementations are going to be a little bit different in each state, I think that's a really great opportunity for states and local communities to push 988, but also talk about what are the resources in the community that it will connect to, because that is different for every community. But access is such an important thing. I mean, that's what our organization is all about, access. We started at Connections just because people don't have a way to get into psychiatric care. A lot of times you start calling the list of people on your insurance, if you even have insurance, and it takes like 6 to 8 weeks to get in somewhere. And so, we started with urgent care, where anyone can just walk in and get seen that day. And, and for the police to be able to drop people off and get people seen immediately. That is such an important thing that hopefully people can, without having to get to the point of needing a crisis, can use things like 988 or like urgent care, psychiatric urgent care, to get connected to people before they get to the point where they're in a suicidal crisis.
I wanted to talk about this Instagram story that really surprised me. Maybe it didn't surprise you, that there was a connection to the teenage suicide rate and those who were on Instagram, particularly young girls.
That does not surprise me at all. We have a youth crisis unit at our Tucson facility, and a lot of those, the part of the crisis involves social media and what people posted on social media. That's kind of, especially in COVID, when everything's so isolated in terms of face-to-face contact, that's kind of your social world. And it's really, Instagram, it's fake. That's the purpose of it, right? It's showing this, brighter than reality ideal that
well, it only shows the best.
Exactly. Like, you don't post about your, whatever it is you don't want to talk about on Instagram.
Right.
And so, yeah, if that's all that you see, and then you start to compare yourself to that ideal, you're never going to measure up, because it's not realistic. So, and especially with eating disorders, that's, we've, before Instagram, it was just the media and newspaper ads and magazines and TV. But now it's with social media, you're immersed in that. You can't really.
It's in your face. It's not as subtle as it was. We only have a minute and a half left. What have we not conquered here that you would like to get out to our listeners?
I would just like to say that the 988 implementation is going to really help a lot of issues. We talked about the issues of people getting the care that they need and having a quick number to call. It's also, I think, there's been, with all of the attention on the police as being the default responders, and we talked about racial disparities and the differences in outcomes. I think this is a really great opportunity also to attack some of those problems by really offloading some of the things that police have been asked to do and put them back in the healthcare system where they belong.
Thank you so much, Margie Balfour, and congratulations on being named Behavioral Healthcare Practitioner of the Year. And after the break, Tim Blake Nelson will be joining us He has directed and is starring in a new movie, and so we'll catch up with him next. Q104.3.
New York's classic rock, Q1043.